Hello, everyone, and a very warm welcome to you. Now, all around the world, most people are counting up the number of days they've been on lockdown, unable to leave their homes for work and other daily life activities, while others are perhaps just about to begin their own version or their own restrictions. The measures are for what has been a global response to curtailing the spread of the coronavirus pandemic. Now, if you fall among the category of people whose movements have been restricted, this is for you. The coronavirus crisis and the restrictive measures that many countries are taking to contain the outbreak can have a negative impact on people's mental health and well-being. This is according to the World Health Organization, WHO, Director, European branch of the WHO, that's Hans Klug. He did say last week that isolation, physical distancing, the closure of schools and workplaces are challenges that affect us, and it is natural to feel stress, anxiety, and loneliness.
How to maintain your mental health during the coronavirus pandemic? How do you cope with anxiety when you are confined and forced to restrict your movement? Now joining us this morning on the program is Raima Amevor, an expert on physical and mental health. Good morning and thanks for being with us on the program. Experts are concerned about the deterioration of mental health during this pandemic. Are you?
Well, I think because of what's happening around the world, this is unprecedented, in our generation. And we haven't ever faced an infectious disease like this worldwide for a very long time. So there's a lot of fear and anxiety about what is happening around the world, how it's going to affect people's health, how it's going to affect their jobs, how it's going to affect their economy. So it's normal that, people are going to feel a bit anxious about it. And, if people already suffer from mental health issues, such as depression or anxiety, that is going to increase during this time. Especially because people are going to have to, and people have already started to self-isolate as well, which means that many people who live by themselves are going to be feeling lonely. They're going to be feeling, a bit cut off. We're not going to be able to go outside a lot and, have fresh air, speak to different people and go about a normal daily life. So there'll be a massive change in routine for a lot of people around the world, which is, definitely going to have a detrimental effect on people's mental health.
So most governments around the world, around the globe, are facing increasing pressure to order a widespread lockdown. What do you think could be done at this period?
Well, I think first of all is that we all have to accept that for the next maybe month or so, things are going to be very different. We can't control everything that's happening outside of us, but we can control what we do and how we react to it. Firstly, there is, and it's good that there's a lot of news about this, but constantly being kind of tuned into the news about the virus will increase, your anxiety. So I do recommend that people take breaks from actually watching, the TV, watching news so much, maybe allocate specific times in the day where they, obviously, watch the news to find out what's going on in the world, but not to be glued into it because that will increase people's anxiety. Thankfully, we live in a time where, digital technology allows us to stay connected to people from around the world. So even if you are self-isolated, which we should be, and we should be practicing social distancing, you can still stay connected to people via your phone, through, WhatsApp, through calling, through Skype. So, although we will be away from people, we can stay connected. And staying connected is, the best way to ensure that your mental health doesn't suffer during this time.
So do you think that the fear of the virus can negatively impact an individual's health?
I definitely think that fear of the virus will exacerbate, people's immune systems, how they're able to react and how they feel about the virus. And as I said, feeling a bit fearful is definitely like normal within this time. I think a good way to counteract that fear is to actually think about the I guess the silver linings of positive aspects, which, you know, one of them is more people are recovering than they are dying. Okay, so, you know, a high number of people do actually recover from the virus. It's a good idea to go onto the WHO website and make sure that you're looking at the facts of what's happening around the world, so you can counteract any negative feelings, any fear about how the virus is going to affect you with, you know, facts about what is happening. There's a lot of information around social media that simply isn't true. And of course, you know, there are a high number of deaths going around, but as I said, people are recovering. And the best thing that people can do to ensure that they're not feeling fearful is follow the guidelines by the WHO, and as best as possible, keep themselves safe and keep their loved ones safe.
And it is important to talk about the people that are recovering. According to the WHO, deaths are highest among the elderly, with very low rates among younger people. But even among the over 80-year-olds, 90% they say will recover. Now, this brings me to their plight after recovery. Any reasons for worrying really about stigmatization?
Yes. I think that the danger is, you know, obviously, you know, people feeling stigmatized, and the best way I think we can all ensure that there is, you know, no stigmatization is actually if the government and businesses are educating people about the disease and about the virus. Once people are educated and they actually understand the virus, how it transmits, how they can protect themselves, there'll be less stigmatization, because people will understand, okay, well, actually, this is something that can be cured, and I can protect myself. If I'm helping somebody out that has the virus, I'll take the best, you know, preventative measures to ensure that I'm also not affected by it.
Thanks for talking to us, Raima. Raima Amevo is an expert in physical and mental health. Away from that to what's making news in other parts of the continent.